We shall be talking about the autonomic nervous system pharmacology today. The autonomic nervous system of the body is part of the peripheral nervous system. But the human nervous system itself is actually broken down into two, which is the CNS and the PNS, the central nervous system and the peripheral nervous system. In this lecture, we are only going to focus on the peripheral nervous system. Because the peripheral nervous system can be further broken down into somatic nervous system and the autonomic nervous system. Somatic means body, and autonomic means automatic. Automatic means you do not have any control over the autonomic nervous system. It automatically works on its own. It regulates your blood pressure, your heart rate, and other parts of the body. Now, the autonomic nervous system can be further broken down into the sympathetic nervous system and the parasympathetic nervous system. Now look at the word sympathetic and parasympathetic. It's parallel to the sympathetic nervous system. The sympathetic nervous system is a flight or fight response, while the parasympathetic is the opposite of the sympathetic nervous system. So how do I remember sympathetic nervous system? Well, think of it whenever you see a snake, or if you see a tiger, or you're being chased, right, by an animal. Well, the sympathetic nervous system usually kicks in when you have this kind of response. You know, your heart rate goes up, your blood pressure goes up, you're running, you're racing, right? You're sweating. And we're going to talk about what actually happens when you see the effect of the sympathetic nervous system. Now, what happens is the parasympathetic nervous is what counteracts that. Let's do an example. Your heart is always under the influence of the parasympathetic nervous system, which uses the vagus nerve, because your heart rate is usually between 60 and 100, right? However, if you have to get into a fight, or you have to be in a flight response where your body is under a lot of stress, you're studying for an exam, your heart rate is beating really fast, wait a minute, like you're studying for the USMLE right now, you know, your heart rate is going up, you feel like you're under a lot of stress. That's the sympathetic nervous system kicking in. At that point, it overrides the parasympathetic nervous system and your heart rate goes up. Now, the sympathetic nervous system uses a completely different receptors compared to the parasympathetic nervous system. The sympathetic nervous system uses norepinephrine or epinephrine as its neurotransmitters, while the parasympathetic nervous system uses acetylcholine as its primary neurotransmitter. Now, the parasympathetic system often binds to a different receptor compared to the parasympathetic nervous system. So the sympathetic nervous system binds to a different receptor. So let's try to get a receptor here. This is a receptor, and we're going to talk about all these receptors, but this is an introductory lecture. They usually bind to an alpha 1, alpha 2, beta 1, or beta 2 receptors. That's it. That's the only receptors the sympathetic nervous system uses, compared to the parasympathetic nervous system, which uses a muscarinic receptor or a nicotinic receptor. Now, this nicotinic receptor are usually of two types, NN and NM. NN stands for neuronal nicotinic receptor, NM stands for neuromuscular receptor. Completely different from the sympathetic nervous system. Now, there's a big difference between the sympathetic nervous system and the parasympathetic nervous system. So let's take a look on the right side of the board here. So I've drawn a schematic to show you where the sympathetic nervous system and the parasympathetic nervous system is found in the body. Your sympathetic nervous system is found in the thoracolumbar aspect of your body, well, which means between your thoracic, okay, and your lumbar region, which means it's found between T1 to L5. That's where the thoracolumbar region is found. The sympathetic nervous system actually is found around the ganglia. Ganglia is a bunch of nerves, right? There are ganglia, they're the thoracolumbar ganglia that lines, that are parallel to your spinal cord. This is where the thoracolumbar ganglia or the sympathetic nervous system lives. However, the parasympathetic system is known as the craniosacral. Craniosacral. There's a reason why you use the word cranial. Cranial means brain. So the parasympathetic nerve, a lot of the nerves that are responsible for the parasympathetic nervous system are coming from your brain and your sacrum, which is your upper cranial nerves, right? And S1, S2, S3, and S4. Remember that. That is very, very important. Now, the cranial aspect of the brain, the parasympathetic nuclei that are responsible for the parasympathetic nervous systems are the cranial nerves 3, cranial nerve 3, cranial nerve 7, cranial nerve 9, and 10. These cranial nerves are the parasympathetic cranial nuclei that are found in the cranial parasympathetic nuclei in the brain, while the sacrum uses the S1, S2, S3, and S4. Now, for the sympathetic nervous system, the portion, remember I told you I found the thoracolumbar spinal cord, they often are very, very short. They are the preganglionic nervous system. So, let's take a look at the spinal cord once more. So, what I've drawn out here is just a schematic to show you where the nerves are coming from. So, the cranial nerve nuclei of the parasympathetic nervous system has a preganglionic, okay, preganglia or preganglionic nerves, and there's a postganglionic nerves. For the parasympathetic nervous system, which is the craniosacral, note that the preganglionic nerves are very, very long, and then they go on synapse with a postganglionic neuron. These preganglionic neurons use acetylcholine. Well, let's look. Acetylcholine. See that? And if we look at the sacrum, all the nerves are also using acetylcholine. ACH. ACH. Okay? So remember that. That's very important. That is a neurotransmitter that's released at the end of the neurons. Now this is going to bind to either a muscarinic or a nicotinic receptor. But here's a catch. Let's take a look at the sympathetic nervous system. The sympathetic nervous system, wait a minute. Oh, they're using also acetylcholine. So the preganglia, right? Pre means before. These are ganglion, where two neurons are synapsed. The preganglionic sympathetic nervous system actually uses acetylcholine. Surprise! Remember I told you about norepinephrine and epinephrine. We're going to talk about that later on. But look, the preganglionic sympathetic nervous uses acetylcholine first in the thoracolumbar region. But wait a minute, they're going to go to the thoracolumbar ganglia, and they're gonna bind. So this acetylcholine is released by this neuron, and let's blow it up. Okay. So the neuron is going to release this neuron right here. It's going to have seminal vesicles that's going to release acetylcholine. Okay? Now let's use red for acetylcholine. Actually, no, let's use green. Okay? This is acetylcholine. And this acetylcholine has to bind to a receptor in the thoracolumbar ganglia. So let's open up a receptor, and this is the receptor right there. For another neuron to pick it up. This acetylcholine is going to come and bind to the postganglion, but the receptor that's going to use is going to be a nicotinic receptor. See that? Nicotinic. But because we're in the neuron, this is going to be a NN, which is neuronal nicotinic receptor for the sympathetic nervous system. But this neuron is going to fire and release its content, and when it releases its content, it's going to actually release either norepinephrine or epinephrine or dopamine. As we can see here, let's use a perfect example. Acetylcholine is released by this preganglionic neuron, binds to this receptor on this postganglionic neuron, which is using a nicotinic receptor, which is an NN, sub N, and that's going to release norepinephrine. Okay, that's the second neurotransmitter. Well, that is the neurotransmitter I've talked about. That is the final pathway of a sympathetic nervous system. So as you can see, when norepinephrine is released, norepinephrine is now going to go and bind to a receptor, okay, on organs like the heart, okay. Also, like, you can bind to organs in your heart, you can bind to the GI tract, and when norepinephrine binds in this case, you're going to get a cascade of the flight or fight response, which means if it binds to the heart, what's going to happen to your heart rate? Your heart is going to go up. What's going to happen to the blood pressure when it binds to the blood vessels in the body? The blood vessels are going to vasoconstrict, increasing the patient's blood pressure. And we're going to talk about this all a lot soon, but this is just an introduction to be able to see what's going on. Dopamine can also be released to bind to D1 receptor on the renal system, okay, on the kidneys. And when the kidneys get D1 receptor activated, it causes vasodilation of the kidneys on the renal system. Now that's a caveat. I have to tell you, the sweat gland on your skin, actually it's different. It's under the influence of the sympathetic nervous system. Now, do I really have to memorize that? No. Why? Let me tell you. If you're running right now, you've got to sweat. Now, which part of the autonomic nervous system is working while you're running? Oh, wait a minute. It's a fight response. Yeah, it cannot be parasympathetic. It's a fight or flight. So I'm under the influence of the sympathetic nervous system, which means all the wires are going straight to every single part of my body, making my heart to race quickly. And then my skin is going to have to sweat. Now, skin is very interesting because let's take a look at the preganglionic neurons for the sweat gland. It uses acetylcholine, which is released to bind to a neuronal nicotinic receptor in the ganglia. Now, this nerve is going to release acetylcholine. Acetylcholine. That is a key important fact, okay? Later down the line, we're going to talk about sympathetic blockers, we're going to talk about parasympathetic agonists, cholinergic agonists. We're going to talk about all these things. But this is going to come into play at some point, okay, when we're going to find out why this is crucial. But what I want you to notice is the acetylcholine is going to bind as the receptor, as the neurotransmitter to bind to a muscarinic receptor on the skin. So the skin does have muscarinic receptors, and this is going to bring us to what are the effects of the sympathetic nervous system and the parasympathetic nervous system and different organ system in the body. Now, before we move on, I'm going to introduce you that the muscarinic receptors is subdivided into M1 to M5. M1 to M5. Now, I'm going to tell you what's important and what's not important for the USMLE exam in a few minutes. We're going over the effects of the sympathetic nervous system and parasympathetic nervous system and the receptors that are responsible for both systems and the response the body gives to this autonomic nervous system. Now, the reason why we're going over this section for review for the boards is to give you an idea what exactly you and I respond to when the systems actually kick in. Remember, they're autonomic, they're automatic. So we're going to start by going through this flow chart, going through from the eyes to the heart, the GI tract, lungs, blood vessels, the GU tract, sweat glands, and other parts of the body, just to have a very solid foundation to understand why this system works. So the first one is the eyeball. Now, inside the eye, the sympathetic nervous system binds to the alpha-1 receptor. Now, remember that we said the sympathetic nervous system uses the alpha-1, beta-1, alpha-2, or beta-2, okay? And the parasympathetic system uses muscarinic receptor M1 to M5. Those are the subtypes. For the USMLE, do not bother memorizing the M1 to M5 subtypes. They will not test you on this concept, but I want you to remember alpha-1, beta-1, alpha-2, beta-2, because those are very key important concepts. All right? So in your eyeball, okay, the sympathetic nervous system has an impact on it. But before we move on, I have to quickly remind you that sympathetic is fight or flight. However, the parasympathetic is rest or digest. So that's how you remember it. Fight or flight response, rest or digest for the parasympathetic nervous system. We're going to go back to that analogy. If a snake shows up in your room or you see a bat in your room, what happens? You freak out, you run, you know, because you're scared. Well, what's going to happen to your eyeball? This is how I think about it. If I'm running, my eyes needs to be dilated. Which means I have to be able to have a good peripheral vision to be able to know where to run and hide. So the term we use in medicine for that, when the sympathetic nervous system is acting on your eyeball, is called mydriasis. Mydriasis. So on the eyes, you develop mydriasis, which is just means vasodilation. And the alpha-1 receptor is where the sympathetic binds. And what happens is this actually causes contraction of the iris, the radial muscles inside the eyes. Okay, let's assuming this is the eyes. Okay, the radial muscles around the eyeball, they contract. They contract like this, in this direction, and causes the eyes to dilate, okay? Now, the opposite of that is when the sympathetic nervous system kicks in, but there's really no sympathetic nervous system that kicks in for the eyes. Once the response wears out, the eyes vasoconstricts back to its normal response. Now, there's also circular muscles inside your iris. However, they're not under the influence of the sympathetic nervous system. The ciliary muscle, on the other hand, is under the influence. The ciliary muscles. Now, the ciliary muscles are responsible for, when they contract, causes your eyeball to constrict, okay? They go into relaxation. The ciliary muscles are under the influence of the beta-2 receptors, okay, the beta 2 receptors, and when that's under the effect of the sympathetic nervous system, they relax, causes your eyes to also I'm sorry, I'm using the word vasodilation incorrectly. I meant to allow your eyes to relax so that you can have more peripheral vision. However, the parasympathetic nervous system does have effect on the circular muscles of your iris. What they do is when this parasympathetic nervous now kicks in, you develop miosis. Okay, so let's use red for the effects, mydriasis and miosis. That means a pinpoint pupil, okay, it becomes very, very narrow, and that's because of the contraction of the circular muscles. When the circular muscles contract under the effect of parasympathetic nervous system, that is what you develop, miosis. And those are under the influence of the M3 receptors. Remember, you don't have to memorize this. I'm just telling you if you really care, but we know they're muscarinic receptors regardless, so that's not going to change. Also, if the parasympathetic nervous system also allows for accommodation, and for accommodation to actually occur on the eyeball, the ciliary muscles have to contract. So when your ciliary muscles contract, you allow you to be able to accommodate. Okay, accommodate is be able to adjust your vision as you see. Okay, and that's basically how the eye responds. Big dilated pupils or narrowed pupils. And we'll talk about drugs that can cause your eyeball to look like that, and drugs that can cause you to have to pinpoint pupil later on. Okay. On the heart, what happens to the heart? Well, we're going to have effect of sympathetic nervous system is going to bind to beta 1 receptor on the SA node. The SA node and the AV node are under the influence of the sympathetic nervous system. And what happens? You get an increase in heart rate because the beta 1 receptor on the SA node and the AV node kicks in and causes increase in action potential, electrical potential down the SA node and the AV node, increase your heart rate. The opposite of that will be decreasing heart rate, right? Decreased heart rate by the parasympathetic, and we know that's under the influence of the M2 receptor. The M2 receptor is responsible for that. But remember, I don't want you to memorize these M2s and M3s, but I'm just referring to it in this lecture. All right? Now, also for contractility, in order to cause increase in contractility, for the heart to be able to squeeze the muscles, you need beta 1 receptors on the heart muscles, okay? The heart muscles have beta 1 receptors, and that causes an increase in contractility in the atrium, okay, and the ventricle. Atria and the ventricles. The opposite of that would be the effect of the parasympathetic. Instead of contracting pretty good, it's going to decrease contractility in the atrium or ventricles. That's the effect of the parasympathetic nervous system on your heart. The effect of the parasympathetic and the sympathetic nervous system on the lungs. This is actually very easy. You don't have to memorize this. When you are running in a fight or flight response, what do you need to do? You need to breathe. Why? Because you need a lot of oxygen to take a lot of deep breaths, allow for oxidative phosphorylation to occur in the body. Exactly. Which means, although you're used to thinking, oh, the sympathetic might cause constriction, but no. In the lungs, inside the lungs, the parasympathetic nervous system binds to a beta 2 receptor, beta 2 receptors, and they cause broncho, from the bronchi, right? Dilation, right? So you're gonna bronchodilate the bronchioles inside the lungs to allow for more air to go in, especially when you're running. That is not the time you need to be wheezing. That's not the time you need to feel short of breath because your body needs all that oxygen. The opposite of that is the parasympathetic effect on the lungs? Well, the parasympathetic is going to cause bronchoconstriction, right? Bronchoconstriction by binding to the M3 receptors or the muscarinic receptors in the lungs, causing bronchoconstriction. We're going to be talking about the methacholine challenge later on, and we're going to see how this effect happens clinically to test for asthma. Patient with asthma, if you give them methacholine, choline, acetylcholine, right? Cholinergic, right? They all sound about the same, which means bronchoconstriction is going to happen because just mimicking the parasympathetic nervous system. On the GI tract, right, we have the esophagus, the stomach, the small intestines, and the large intestines. The effect of the sympathetic is going to be fight or flight, but we said the parasympathetic is rest or digest. Rest or digest, right? Rest, but in this case, we're going to use the digest part. The entire enteric nervous system is lined up with the vagus nerve. Ooh, the vagus nerve is a parasympathetic nerve. Let's see. Vagus. Vagus is number 10. It's a cranial nerve. Oh, we said that already. It starts to make sense now. So cranial nerve number 10, which is the vagus nerve, passing through your entire GI tract, is a cranial nerve using acetylcholine. Acetylcholine. So the parasympathetic system is going to help you with GI motility. So when you eat food, food can digest easily inside the GI tract. Inside the GI tract, okay? And also allows for relaxation at the rectum for defecation. Now, when you're running, that's not the time to go to the bathroom. Oh no, you know what? This is a great time for me to go take number 2. Yeah, you can't be defecating while you're running because when you're under stress, you cannot. But we have to realize the sympathetic, on the other hand, causes constriction in the GI tract, affecting the alpha 1, alpha 2, right? Alpha 1, alpha 2, and beta 2 receptors in GI tract to slow down digestion. Slow down digestion. So, let's take a look at what happens in the blood vessels. Blood vessels. All right. So we have a lot of blood vessels in our body, right? And blood is constantly flowing through them. The blood vessels, what's the effect of the sympathetic? Very easy. Causes vasoconstriction. Vasoconstriction. And what receptors does the sympathetic use again? Repetition is always a good thing. Alpha 1 receptors, right? On the alpha 1 receptors and also the beta 2 receptors are found on the blood vessels. Okay? And this will cause, with the sympathetic, we're going to use S for vasoconstriction. This is very important concept because when you're under a lot of stress, all that blood has to be vasoconstricted away from the GI tract, because that's not the time for you to be using it for rest and digest. So all the blood can be shunted to the brain, to the heart, right? Increase your heart rate, increase your blood pressure, increase perfusion to the brain. See how the body is smart? This is called autonomic, right? It's automatically doing that, all right? Bronchoconstriction, vasoconstriction of the blood vessels, okay? The opposite side of it, there's no parasympathetic effect on the blood vessels. Most of the blood vessels are innervated by the sympathetic. So what happens is once this wears off, the blood vessels go back into vasodilations once the epinephrine, right? And the norepinephrine stop binding to your blood vessels. So let's now see what the effect of the sympathetic nervous system is on the genital urinary tract. Now, the urinary sphincter, all right, so we've gone from eyes, heart, GI tract, lungs. We've gone through the blood vessels. We're going to go to the GU system. So the GU system has the bladder. And remember, the bladder has an outflow tract where you got to pee. The urinary sphincter. This is the bladder. There will be urine in there. Okay, I just combine it together. This is the uterus. We'll talk about the uterus, penis. Okay, these are called genitals, urinary tract, the bladder. So what's the effect of the sympathetic on the urinary sphincter? This is a very important concept because we're going to talk about this all later on when I put it all together after this introduction. There are alpha-1 receptors. So this is a good idea. Let's blow this out so you can see what we're talking about. Okay, so this is the bladder. And inside the bladder are the detrusor muscles and little smooth muscles, okay? Right on the walls of the bladder. They allow you to contract the bladder when it's full. So when urine fills up, right, this is urine. And the urine has to come out through the outflow tract. But there's a urinary sphincter that's always closing here. They're alpha-1 receptors right at the edge of the sphincter muscles. These are smooth muscles. When the sympathetic nervous system is acting on alpha-1, it causes constriction, right? It causes constriction, so it prevents urine from being passed out. That's why when you're under stress, you don't want to pee in yourself. You hold your bladder really tight. However, the parasympathetic system acts on the opposite, binding to the muscarinic receptor, just more specific, is an M3, and causes relaxation. So when you wake up in the morning and you're taking a piss, that is your parasympathetic nervous system allowing you to relax the sphincter muscle to be able to urinate. Alpha-1 will cause constriction. That's sympathetic. What about the bladder wall? Now, the bladder wall has beta-2 receptors on it. And these beta-2 receptors, under the influence of the sympathetic nervous system, will contract. Will relax. So they get relaxation. However, the parasympathetic nervous system is responsible for contraction because there are also muscarinic receptors. So let's put little M receptors here, okay? There are beta receptors. Let's put the beta receptors there. Okay, this is for sympathetic. The muscarinic is to allow acetylcholine to bind, okay, from a neuron. When they bind, the detrusor muscles are going to contract. And take a look at this. This is how the parasympathetic works in combination. It binds to the detrusor muscles contract, but because there's an outflow tract, also it's going to bind to the muscarinic receptor at the urinary sphincter, so that when the bladder is contracting, it's not contracting against a closed opening, so that when you relax the urinary sphincter, urine can easily come out. Now, hold that thought. Let's go to the side of the board. Where is the parasympathetic nervous system? Oh, wait a minute. We said it's cranial, sacral, cranial, sacral, cranial, sacral. Sacral has parasympathetic, which involves S1, S2, S3, S4. S1, S2, 3, 4. Keep your bladder off the floor. Look at that. That's it. All those pudendal nerves all the way down there are all parasympathetic nervous system. And they use what? Acetylcholine. So acetylcholine is going to come and bind to that receptor on the bladder, and also the M3 receptor on the urinary outflow tract, and you can urinate. Very, very easy. Very easy, guys. All right. So let's see what happens in the uterus. In the uterus, it's a little bit more action going on in the uterus, okay? So here's the uterus. If a woman is pregnant, all right, expecting to have a baby, it's always good news. The effect of the sympathetic nervous system is going to bind to alpha-1 and beta-2 receptors inside the uterus. Now, the effect of the sympathetic nervous system will cause contraction alpha 1 and beta 2 on the smooth muscles on the walls of the uterus, so that when the smooth muscles contract, it can push the baby out. All right, can push the baby out. However, if the uterus is not pregnant, the beta 2 receptors are activated, and that causes relaxation. So there's really no effect of the parasympathetic on the smooth muscles, just all under the influence of the sympathetic nervous system. Now let's talk about the penis. The penis has effect of the sympathetic nervous system. I'm going to teach you a mnemonic you will never forget. This is how you remember for the rest of your life what the parasympathetic and the sympathetic nervous system does on the penis. It's called point and shoot. Parasympathetic points, which causes erection, points, all right, and shoot from the sympathetic nervous system. So what am I saying? Well, what is he talking about? Point and shoot? All right. So here's a penis. And so the parasympathetic nervous system uses what? Muscarinic receptors. Muscarinic receptors under the influence of which neurotransmitter? Acetylcholine. The penis is all the way down there in the genitourinary tract. So the parasympathetic nervous system, which I'm just going to use para, okay, is going to cause point, P for P, okay, and which means it allows you to have an erection. So for a man to have an erection, you need the parasympathetic nervous system to lift the penis and get into erection, full dilation of the penis. Now, in order to, for the sympathetic nervous system, is remember for shoot. What is shoot? Ejection of sperm. So when a male is having intercourse with a female, the erection has the parasympathetic nervous system, so it's point, and sympathetic allows for shooting out of the sperm. So don't ever forget that. Now, the alpha 1 receptors are being responsible in the sympathetic nervous system, just as similar to the alpha 1 receptors that are similar right where the urinary outlet is. It's the same thing. Males have just one urinary outlet, right? And it's basically where urine and sperm comes from. And what happens is at the base of the urethra, at the prostate, right? There's the prostate and there's seminal vesicles. And these seminal vesicles are just going to secrete a lot of sperm, and this is going to cause shooting out of sperms, okay, during intercourse. So, really cool mnemonic. Don't ever forget that. Now, let's take a look at the secretory glands in the body. What secretory glands do we have in the body? Well, we have the sweat gland. So this is like a structure of the sweat gland, okay? It's almost like a 3D structure. This is like the sweat. This is the sweat gland. And let's see what happens when somebody is under the effect of the sympathetic nervous system. Well, when you are running, you should expect to be sweating. So there are alpha 1 receptors under the sweat glands that causes local secretion under the effect of the sympathetic nervous system, causes secretion of sweat, which makes sense. When you're running, you should be sweating. That's not the time to not be sweating, because you're releasing a lot of carbon dioxide. You're using a lot of water to cause you to reabsorb heat from the body to cool off the body. Now, secretion-wise, also there's secretion inside the GI tract, and inside the GI tract, secretion is actually decreased inside the GI tract when you have the influence of the sympathetic nervous system. And inside the bronchioles, which is in the lungs, you have increased amount, actually there's no effect of the sympathetic nervous system inside the lungs for secretion, but increased secretion under the influence of the parasympathetic nervous system when patients are having effect of parasympathetic inside the lung. So parasympathetic causes bronchoconstriction and secretion. Now, what disease pathology are often tested on the boards that has that effect? Asthma, right? So asthmatic patients have a lot of secretions in their lungs, that mucus and all that fluid, and also they get bronchoconstriction of their airway. So combination of both causes wheezing, and the patient feels shortness of breath clinically. Okay? Now, let's talk about metabolism. Let's take a look at the few other organs left. We have the pancreas, the adrenal gland, the kidneys, and skeletal muscles. So the adrenal gland is special. So I haven't talked about adrenal gland much because it's a special organ. The adrenal gland is found on your kidneys, and as you can see, the preganglion, there's only one preganglionic neuron that goes into the adrenal medulla. It's different from the cortex, that's the outside. The inside of the adrenal gland is the medulla. Inside the adrenal medulla, the acetylcholine release binds to receptors inside the adrenal gland, and they bind to nicotinic receptors. So inside this adrenal gland, there are nicotinic receptors that are waiting to bind to that juicy acetylcholine. And what they do, they undergo a cascade of chemical reaction, okay, secondary messenger system, to eventually cause the release of epinephrine and norepinephrine. Whoa! Epinephrine has effect of sympathetic effect on the rest of the body. But in order to get acetylcholine, in order to get epinephrine released, you actually need acetylcholine to actually stimulate the release of epinephrine by binding to nicotinic receptors, right? The nicotinic receptors inside the spinal cord. Also, in the kidneys, the sympathetic nervous system has a great effect on your kidneys. So let's take a bigger look at the kidneys. So these are very key important concepts. This is the kidney, has a renal artery, okay? That's the medulla on top of it, and now the renal arteries has beta-1 receptors on them. And in order to increase the release of renin from the kidney, you need the sympathetic nervous system to bind to beta-1 receptors on the kidneys. That will actually activate renin, and the way that activates is by decreasing perfusion to the kidney, right? Any decreased perfusion to the kidney because of the vasoconstriction of the beta-1 receptors on the kidney renal artery, and eventually affecting the arterial level, will cause increase in renin, because that's what stimulates renin release. How about the skeletal muscles? Skeletal muscles are special because they have beta-2 receptors on them. Now, beta-2 receptors on the skeletal muscles under the influence of the sympathetic nervous system causes breakdown of glycogen into glucose. What's that term called? Glycogenolysis. That's just a big fancy word for taking glycogen and breaking it into two and forming it apart into glucose, okay? And also allows for contractility, yeah, the muscles contract also under the influence of the sympathetic nervous system, okay? And let's take a look. We have a voluntary motor nerve here, okay, that release acetylcholine. Acetylcholine that goes directly to skeletal muscles, and we're going to talk about that later on because that will be the somatic nervous system. In the pancreas is a very important organ. In the pancreas, there are beta-2 receptors in the pancreas. So I think it's always, whenever I eat food, I think to myself, it's better to release insulin, because that will bring down my blood sugar a little bit. What did you say? It's better to release insulin. Well, that's how I remember the receptor, beta-2 inside the pancreas, right? And it's also better to break down glycogen into glucose. So this, as you can see, are very easy because this releases insulin under the influence on the sympathetic nervous system. Okay? Oh, I'm sorry, actually it decreases release. It decreases insulin secretion. I take that back. Sorry, that's wrong. So sympathetic nervous system has an effect to decrease insulin release by the sympathetic nervous system. And on fat cells, it causes lipolysis. Lipolysis. Well, we've covered the entire body, all the receptors that are under the effect of either the sympathetic or the parasympathetic or both at the same time, as you can see in this introductory lecture. This is now going to take us into the next session, which are cholinergic drugs. We're not going to learn about all the pharmacology that will be tested on the boards, because guess what? That's the high yield information that's coming. All right? See you in the next lecture.